All right. Hello, everyone. Sorry for the delay, but back doing lives again. So thanks everyone for coming on and asking questions. So today is it's the 20th of October for me, 19th of October for people in the U.S. And I have to go into the office today. So we'll be doing about an hour and 15 minutes, and I'll have to stop at around 10:30 a.m. my time, which is sort of 10:30 p.m. Eastern time, 7:30 p.m. Pacific Coast time. So we'll get answer as many questions as we can by then. So first question is from Josh. He says, "Hi, would carnivore likely improve sarcoidosis?" That's a good question. I have spoken to a couple of people with sarcoidosis, and they have improved. Now that's anecdotal, so we just have to see. We don't really have great reasons or explanations for sarcoidosis. Like a lot of things, they're just these things that crop up, and people have problems with them, and then we don't have great treatments for them because we don't really know what's causing them. So the likelihood is that this is something environmental exposure related, such as diet, and that changing that exposure can improve things. And that certainly seems to be what some people have experienced anyway. Also, just like I've said with other things, if you're going carnivore and you improve your health in other ways, you're eating an ancestral diet, you're eating a biologically appropriate diet, your body's going to improve in a lot of ways that that are going to help. And so even if your sarcoidosis specifically doesn't improve, your health in general is going to improve. And so you dealing with the sarcoidosis is going to be a lot easier because you're going to be healthy in a lot of other ways as well. So hopefully it does help with that. I can't say for sure, but there have been people that have improved. And but I can tell you that you'll improve in many, many other ways that will still be worth it either way. So good luck with that. And if and just let us know how that goes either way. That's good information to have. A question from Donna. Thank you very much for the super chat. I have CFS/ME and Hashimoto's and am new to carnivore for 2 months. I've experienced significant oxalate dumping twice. Do you advocate adding non-carnivore foods to slow it down, per Sally Norton? I think that's fair. I think it's if it's not something your body is clearing well itself and that can help, then sure. I mean, it's the idea of using things medicinally. You wouldn't use a medicine every day, all day, year round for life. For most things, certainly not for acute issues. That's the whole idea, is if you do have to take something every day for the rest of your life, are you really treating the issue or are you just covering it up? And so that's a lot of medications now are just covering things up and not addressing the underlying cause. So I think that the oxalate dumping, would, if that's what's going on is the underlying issue, and then you use medicines to sort of, or like, some low oxalate foods that you can use sort of medicinally, if you want to think of it that way, so that it mitigates the dumping response from your body. This is something it's sort of hard to measure, and it's hard to know exactly what's going on because there aren't great ways of measuring it. I understand from reading Sally's book and speaking with her that it's difficult, and sometimes you have to just go symptomatically by these things. But if you're having a rough time and it's not improving on its own, and you add in 50, 80 milligrams of oxalates a day, and that helps, well then, okay, great. It shouldn't have to be a permanent thing. You shouldn't have to do that forever. It can take a while to clear all this stuff out of your system, but eventually you should be able to come off of that. And so, I think you're doing the right thing. Certainly with autoimmune issues, it's very beneficial to go on a complete elimination diet, like a carnivore diet, because you're getting out a lot of things that are triggering these immune responses. And so if you need to add in a bit of oxalate containing foods, I don't think that's a problem as long as that's actually helping. Um, Speaking to Sally, she said that a lot of people, most people, won't have the really horrible oxalate dumping. And so most people just have a bad couple of days, maybe a bad couple of weeks, and then they'll get through it. But others will have a very, very serious time with it. And so for those people, I think it's, I mean, she's the expert on that one. So, that's what she's found to be most beneficial for people. So that's what I would go with. And I would think of it as a medicine. You're doing something medicinally, you're treating an issue specifically, and that issue, shouldn't have to be treated forever. It's just while you're dealing with that. So yeah, if that helps, then yeah, definitely go for it. Question from Tronzer. Thank you for the super chat. Any resources for high protein, mid fat diet? I get massive cystic acne eating ground beef. I'm 26, doing this for knee arthritis. Macros: protein 280, fat 60, carbs 45. So, I mean, there's going to be plenty of resources out there. There's going to be a lot of different studies and opinions and so on with that sort of thing. One thing that's pretty consistent is that if you get the majority of your macros from protein, then that can cause problems. This thing called rabbit starvation or protein poisoning. It's not that sort of traditional, like, oh my god, too much protein is going to destroy your kidneys. It's not, that's not really the case. It's just that if you get the majority of your calories from protein, then for some reason that can cause a bit of harm. So you want to have sort of more carbs and fat as a percentage of calories than you have protein. Generally, from what I've spoken to different people, it's sort of like 4.5 grams of protein per kilo of body weight, which is quite a lot. And that starts to become a problem. So that's a huge amount. I doubt that you're there. Depends on how much you weigh, though. If you're sort of 60 kilos or something like that, then you're sort of approaching that range with 280 grams of protein. But either way, fat is very useful, and it's really important to get enough of it. It's an essential nutrient. It's not just a calorie source. They're essential fatty acids. They're essential fat soluble vitamins, minerals. You need them, and so you want to get enough of them. And 60 grams is probably not enough, especially if you're young and active. And if you're eating 280 grams of protein, that's probably too much. And then you also have to remember that carbs, eating zero carbs is better biochemically than eating low carbs, because 45 grams of carbs a day is enough to raise your insulin. That insulin will suppress your body's ability to make your own carbs and your own ketones. And so you actually feel worse. You'll have less energy than if you ate no carbs at all, because then your body would actually start running on its fat stores. So, and the cystic acne thing, that's quite often hormonal. And so it usually depends on what else all the different sorts of things you're eating. If it's ground beef in particular, that's a bit strange that other beef wouldn't cause it, but ground beef would. And so I would sort of see what else is going on in your diet as well. But if there's something that you're reacting to, and ground beef for whatever reason seems to have that effect, then certainly avoid it. But I would seriously consider increasing the fat. And if you can, get rid of the rest of the carbohydrates. I think you'll feel a lot better doing that. Just get rid of the last of the carbohydrates. Then your insulin's going to go down. Your blood sugar is going to actually normalize and stabilize. You'll have very consistent, stable energy throughout the day. And I think that will improve things and increase the fat. The fat's very important. It's an essential nutrient. So generally, you want to get equivalent grams of fat to protein. So if you're getting 100 grams of protein, you want to get 100 grams of fat. At least some people get up to 2 grams of fat per gram of protein. So see how you go. But I would adjust that up. I would take in more fat and animal fat, and I would try cutting out the carbs, but try to balance out your protein and fat if you can and get that closer. I think you'll feel better. J.R. Kerfman, thank you for the super chat. Hi, Dr. Chaffee. Do you know if strict line diet could help cure hereditary spastic paraplegia? It's a degenerative disease that involves weakness and spasticity. It runs in my family. Thank you. That's not one that I've seen, in the context of carnivore diets, and it's not something I treat in normal practice. That would be more on the neurology side of things. But I've seen a lot of people improve neurologically that no one thought would and no one thought could. People with 30-year-old strokes that all of a sudden resolved their weakness and balance issues 30 years after the fact. That was a guy, Dave Mack, that I've done podcasts with on each other's channels. And he had a stroke 30 years earlier and had done keto and all these other sorts of things, paleo, Atkins, and then was stable neurologically for 30 years. And then a few months into carnivore, all of a sudden his weakness is resolving. Pretty crazy. And people with multiple sclerosis and other neurological issues improve. So I don't know. I mean, I've even spoken to people that have had cerebral palsy say that they were starting to improve their spasticity. Pretty interesting. So this is all anecdotal at this stage, but it's all about that self-experiment. If you try this and it helps you, then it's helping. That's working. Oh, but there's no study that says it. Who gives a shit? It works, right? So there's no randomized controlled trial showing that parachutes work, and yet we still use them because we're not idiots, right? So there's evidence that exists outside of studies. And your own experience is the most important piece of evidence, because that's what we're talking about. We're trying to get information about how best to live our lives and improve our situation. And if you do something and you try it and it improves your situation, well, that was the end goal anyway. You don't need a study for that, because you have studies to guide your actions and what you do and see if that helps. But if you try it and it helps, you skip the middleman. So that's the main thing, is just, give it a try and see how it goes for you. Hopefully it does help. That would be great. I mean, people with Ehlers-Danlos and even a few people with Huntington's disease, of all things, have said they've improved, which is crazy. I didn't know that was possible. I thought that was like 100% penetrance. They're just like, you get that gene, you will have Huntington's at some point. It's just a matter of when. And apparently people have been improving with that. How much, I don't know. But we'll see. It's very encouraging anyway. So I would definitely give it a try. Give it a solid 3 months and of just fatty meat and water. You need the fat, especially for neurological issues, because your nervous system is made out of fat. So you need the fats. And so I would eat a lot of fat, eat a lot of meat, and don't eat anything else, and see how you go. And please do let me know how that goes, because that would be great to see how you're doing. Michelle, thank you very much for the super sticker. I appreciate that. And Heidi Wingard, thank you very much for the super chat. It's very kind of you. Hello, Dr. Chaffee. I was diagnosed with sarcoidosis 5 months ago, prescribed 10 milligrams of prednisone 3 times a day. Do you have any insight on the effects of carnivore on sarcoidosis, or the interaction of prednisone on carnivore? So, so I have seen a couple people improve their sarcoidosis with a carnivore diet, which is amazing to see. And, you have to still be cautious with these sorts of things, because they're just individual people's outcomes. That doesn't necessarily mean it's going to help everybody every time, or even that it was that helped them. You don't know. But it's very promising. People have gone on carnivore and they've improved. Not great treatments for sarcoidosis. Prednisone, basically, think about it this way. Prednisone is an anti-inflammatory. It's a very strong anti-inflammatory, basically just halts your immune system. And so one of the best things that I've found for people is these elimination diets. You stop eating these things that your body's reacting to, and your immune system really settles down. And so, just like with autoimmune issues, when you eliminate out these things from your diet, a lot of these autoimmune issues improve. And so, same principle could apply to sarcoidosis. I haven't seen enough people with it to say, "Wow, this is pretty convincing to me." But I have definitely seen people improve. Now, interactions with prednisone, the only real interaction is that it's going to make you hungrier, and so you're just going to have an increased appetite. So if I still think you want to try to just eat until satiety, eat until fatty meat stops tasting good. But if you find yourself sort of putting on weight and eating sort of more than your body wants, that can be why. So when people are on steroids and things like that, like prednisone, it's it's just one of the side effects is it increases your hunger signals, and it can mess with your insulin, and long term high dose can cause diabetes and mess with your blood sugars and all these sorts of things. So it's and cause insulin resistance and all these other sorts of metabolic issues. So hopefully you do improve, and hopefully you're able to come off of that medication. There's nothing besides the hunger thing. I don't really know of anything that's really going to be a problem with prednisone and carnivore specifically, but it's going to cause a host of other problems that are you would be far better off if you didn't have. And so hopefully you improve enough that you don't need to be on the prednisone anymore, and hopefully can come off of that, because it has a lot of its own problems. So hopefully you can come off. And then super chat from Terry. Welcome back. No question, just support. Oh, well, thank you very much, Terry. That's really kind of you. Very generous. Thank you very much. Zeus Wayne, thank you very much for the super chat. Endurance athlete here. Your interview with Sean Seiko converted me 6 months ago. That's great. I'm going for a solo 100-mile run soon. Awesome. Any advice on how to fuel for an event like that? Well, I've always performed best on an empty stomach. I always say, you want to play on an empty stomach. You have that sort of that your body's just basically giving you all this energy to say, hey, go kill something, get your meal, get your kill, and so I always felt very good, energized, and aggressive when I did that. So I would eat the night before. I would never eat the morning of. And Sean, who is for people who don't know, he's an long distance endurance cyclist, performs at a very high level and a very high output, and trains fasted and rides fasted and just eats carnivore. So I would still do that. I would eat the day before, and I would not eat anything the morning of. Unless you're extremely emaciated, you're going to have a lot of fat stores. You're going to have really weeks of fat reserves. So you can go fine with a long distance sort of thing like that. There are people. There's like Charles Washington. He has been doing carnivore for like 20 years now, or close to anyway. 15, 17 years. And he runs marathons on carnivore, fasted, without water. He doesn't drink water the same day. I like water. I definitely feel really good drinking water. And so I generally drink a lot of water on game day when I'm working out and things like that. And I feel better for doing that. So I would just go with your instincts on that. You definitely don't want to get dehydrated, especially with a 100-mile run. You probably need some damn water. So hydrate as you deem fit. But I would try not eating. I would try not to eat, the day of anyway, and just high fat meat. But you're gonna have fat stores. That's what you're gonna be running on. You're not gonna be running on the food that you ate yesterday or that day. Really, what you're gonna be running on is the food that you ate 2 weeks ago, 3 weeks ago, because that's where your fat stores are. If you felt you needed a refuel, then I would just use like tallow, just like fat, or like pemmican, like the carnivore bar sort of thing. It's 2 grams of fat per 1 gram of protein. So it's like 80% calories from fat. That's what I would do. It's going to be something that your body's just going to absorb very quickly, very readily, and that you're going to be able to just kick into energy. But realistically, you probably won't need that. I think, the most you're going to need is really water. But if you're going to refuel, you can refuel with those sorts of things. Just like a high fat pemmican type of thing, or just straight up tallow. You can get that in a little, almost a liquidy thing, just slurp it in, and hopefully absorb more than you don't, because last thing you want to do is have to run to the bathroom in the middle of a 100-mile race. So that's what I would do anyway. And good luck with that. Let us know how that goes. And especially let us know how that goes, because this is something that, people say, oh yeah, if you're an endurance athlete or high distance or this, that, and the other athlete, blah, 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 blah. There's always a type of athlete that can't possibly work without carbohydrates. And yet we have athlete after athlete after athlete, high intensity, weightlifting, track and field, sprinting, distance, and every time, but this other one, no. And so, it's good to get more and more people out there, more and more athletes out there showing that this is actually very beneficial. So, do let us know how that race goes, and also how your training now is going too, because that's obviously very important. Ryan Haney, thank you so much for the super chat. Been carnivore for months with great fat loss, but recently gained a few pounds. I've been lifting weights, but started eating yogurt as a daily snack. What quantities of dairy, if any, is a good rule of thumb? Pretty low amounts. I mean, I think that if you're having some as basically a supplement for the bacteria to sort of reseed your microbiome, that's fine, but you don't need much. You just sort of like a little spoonful, a little dollop on your meat, and you chew it up with the meat in the same bite, swallow it together, and that can get some of that bacteria into your gut. After a while, I don't think you need to keep maintaining that. If you would take antibiotics, or if you're coming from a different state or whatever, it might be good to bolster your microbiome. But eventually you're going to have a good microbiome that's going to be supported by just eating meat. Dairy can be a trigger for weight gain. And sorry, just got a little visitor here. Can be a trigger for weight gain, and people eat enough dairy, they tend to eat the same amount of meat, but they also eat dairy, and sometimes they can put on a bit of weight. It's also a bit pro-inflammatory, so some people have a bit more of a problem with that. And the because the casein proteins can be a bit pro-inflammatory, as well as A1 and A2 casein that you can get. A2 is less inflammatory, but it's still inflammatory. So they're both a bit inflammatory, and A1 more than A2. Lifting weights is going to make you put on muscle as well. So always remember that just because you're gaining weight doesn't mean you're gaining fat. It could be that you're gaining muscle. And if you're lifting weights on a carnivore diet, you are definitely gaining muscle, because I've never found it easier to put on muscle than when on a carnivore diet. So you're definitely putting on muscle, and so you're going to gain weight from that as well. If you do think that you're putting on fat as well, probably eat less yogurt. And so, and if you're going to have some, I wouldn't be eating bowls of this stuff. I use dairy, as a condiment only, and then infrequently. So my mainstay is just eating meat, having a bit of dairy every now and then, fine, but have it with meat as a condiment to meat. I would never just have a bowl of yogurt and go to town on that. I just have a bit of yogurt with meat. So that's what I would do. And if you think you're putting on fat, then definitely cut it out. It's going to be different for different people. There's no sort of hard and fast rule that I know of for for how much dairy someone can have. It's just that I would just use it very sparingly, and possibly not even every day, unless you're trying to sort of rebuild your microbiome. So good luck with that. And wow, Susan back with a very, very generous super chat. Thank you so much for that. That's really kind of you. And just says deep gratitude. Well, thank you very much. I'm very grateful to you. And I hope that this has helped you and others, and hopefully we can get a lot more people a lot more healthy, and not stuck on all the medications and everything like that they have been stuck on. That's what I was sort of thinking about is, if you don't eat the modern food, you're not going to need the modern drugs to treat the effects of the modern food. So let's get back to eating what we're supposed to eat biologically, and let our bodies just work properly. So thank you very much, Susan. That was very, very kind of you. Julie R., thank you so much for the super chat. Hi, new to carnivore and I'm not eating enough. Okay, that's very common. Don't really feel like eating. How do I determine how much to eat and how to get enough fat? Thanks. So your hunger signal is going to be very different, and so you're just always going to feel a bit satiated generally. And so what you want to do is you want to keep eating fatty meat until it stops tasting good. If you're eating very lean meat or moderately lean meat, it's going to stop tasting good a lot sooner than if there was fat in it, because your body said, okay, that's enough of the lean stuff. I need the fatty stuff now. And so you want fatty food, fatty meat, and you want to keep eating until it stops tasting good. You get, obviously you get enjoyment from eating, and that's why your body says, giving you a reward, saying pat on the head, good job. You ate something that we want this. That's a reward. But then it's negative feedback. Every time you eat fatty meat, it tastes less good and less good and less good until finally it doesn't taste good at all. And that's your body relaying to you saying, hey, we don't need this anymore. So unless you're on like prednisone, some sort of medication that's going to increase your hunger, that's what you listen to. And as long as you're not eating carbohydrates as well, because carbohydrates will raise insulin, that will block leptin, and that will screw with your satiety signals. So you want to, if you're just eating meat, then that's what you do. How do you get enough fat? You go by your stool. So if you're not drinking coffee, tea, or using artificial sweeteners, those are all laxatives, then you look at your stools. If your stools are dry, hard, craggly, rocky, constipated, hard to pass, that means you're not eating enough fat. You want to eat enough fat until your stools are soft. If you're having soft stools, but you're also eating artificial sweeteners or drinking coffee or tea, those are laxatives. So you're probably not eating enough fat. You probably would be constipated if you weren't drinking the coffee and tea and so on. So I would just, meat and water, bit of salt maybe, and eat enough fat so that your stools are soft. Now, if they are too runny, then you can pull back on the fat or stop the coffee and tea. And that's sort of how you know. Taste also helps. Eat fatty meat and it's like, wow, that tastes really good. Your body wants that. Bring that in. And but that's the main thing is just going by taste and then looking at your stools. So that's pretty much it. And so constipation is not frequency. So if you go once a week, once every 2 weeks, doesn't matter as long as the stool is soft. It's just that, normally we're kicking out all the stuff that we ate in. We're kicking out like 95% of the solid matter that we're eating because we can't digest plants. So most of it goes out the other end. Whereas with meat, it's the opposite. 98% or more can get absorbed depending on how much gristle and things like that you're eating. So, that is the opposite. So you're just going to have much less waste. So normally if you have all this waste built up and it's not going out every day or multiple times a day, well, then that's probably because something's stuck and blocked up and you're constipated. But it's the consistency, not the frequency. So just remember that. And I have videos on that as well. So if you look at getting started on a carnivore diet for beginners, and then the one I did on fiber, constipation, and diet, those all explain a lot of those things in a bit more detail as well. And Laurel Roeder, thank you very much for the super chat. Question: I ordered 2% Lugol's iodine after watching Dr. Berry. I take T3 and T4 for hypothyroid. I no longer have symptoms. Great. What's your opinions about 2 drops of iodine? It sure doesn't taste healthy. Well, look, if you are deficient and you need a bit more iodine, then you should probably take some iodine. If you're getting it from your food, that's obviously the best way. It does exist in food, but doesn't necessarily exist in the amounts that we need, depending on how the animal was raised and farmed in the area that it was raised and farmed in. Animals that are closer to the coast are going to have more iodine because they get more sea spray and other things like that coming out of the oceans. If we have a bit of seafood in our diet as well, that's going to bolster our iodine amount. So if you were taking T3 and T4 and then added in the iodine, you felt better, well, then your body probably needs a bit of iodine, because that T3 and T4, that's the number is the amount of iodine molecules in there. So there's 3 in T3, 4 in T4, and so on. It's T0, 1, 2, 3, and 4. And that's how many iodine molecules are in there. So you need iodine, but you don't need too much. And so, if you have enough, then you don't necessarily need to take it. So you can always check your iodine levels. And if you have normal iodine levels, great. Then you probably don't need to take those. Your hypothyroidism will likely improve on a carnivore diet. I see it happen all the time, that this goes in that direction. I have a lot of patients, a lot of people are hypothyroid and don't even realize it. And that's just because it's subtle, and you check your thyroid and it's in the sort of the so-called normal ranges, but everybody's just a bit sick now. And so the normal ranges are just showing people that are sick. And so if you look at reference ranges that are, more tight, that say, okay, what are healthy people in their 20s looking like? What do their numbers look like? It's very different. And so if you look at that, you realize, yeah, these people are actually out of that, maybe only slightly. You pick up things earlier. And so normally people don't get put on thyroid medication unless they're really out of balance. And so I would, and so a lot of people actually have thyroid issues, and but they're just subtle enough that they don't, they're not enough to get picked up by a normal doctor or get put on medication. So I'm glad that you're not having any symptoms. That's great. You should get in touch with your doctor, check your thyroid hormone, and all your levels, and see what your body's doing, and check your iodine levels. And if you don't need as much thyroid medication, you can start ratcheting that down with your doctor, maybe even come off of it. A lot of people can, or at least reduce the amount that they're on. Sometimes it takes longer, especially people with Hashimoto's, it can take a year or two of being, very strict lion diet, just red meat and water. So, it's not an overnight thing, but it can happen. So hopefully that's the case with you. If you feel that you sort of feel the same, whether you are or not taking iodine, maybe you don't need it, check your bloods. If your iodine is in a good range, without the on the supplements, fine. You can come off of them, check it again in 2 months, see what your thyroid is doing, see what your iodine levels are doing, see how you feel, and then, make a decision from there. If your iodine stays up in that nice good range without the supplements, well, then you're getting everything you need from meat, which is what you want, ideally anyway. So that's what I would do. Les Kisser, thank you very much for the super chat. Hi from Ohio. I never hear much about eyesight on carnivore. On day 35 now and reversing my eyesight. Glasses had to be removed. Awesome. Can see perfect now without them. Crazy. Yeah, it is crazy, isn't it? Yeah, I have heard that. I've seen people that have actually improved their eyesight. Excuse me. Dr. Chris Kenobi is an ophthalmologist, and there are other ophthalmologists sort of in this space, and they've talked about like macular degeneration, things like that. That this is a product of eating sort of the wrong thing, and that and then like insulin resistance and all these sorts of things. So and seed oils and all that other sort of stuff. So all this nasty stuff that's sort of getting in our body and gumming up our very sensitive organs like our eyes, and so they found that that sort of eating a more ancestrally appropriate diet, a biologically appropriate diet, actually improves macular degeneration, actually improves eyesight, and it's interesting because is it going to help all causes of poor eyesight? Definitely not. But there seem to be many people that improve their eyesight and have to come off their glasses, which is amazing. And so, obviously there are some forms of poor vision that are diet related, which is interesting. So it'd be very interesting to have someone sort of investigate that. And maybe that's the thing. Maybe people that have had this same thing, maybe comment in this video, what sort of vision impairment did you have? Nearsighted, farsighted, why was that? You have astigmatism? Did you have other sorts of issues? And say what you had and what improved and all that sort of stuff. Maybe I'll leave a pinned comment or something like that, about this, and then people can sort of respond to that. And then maybe we can get some data. Maybe we can just see, okay, well, it seems to be people with this particular kind of vision impairment can improve. And that would be really interesting to see and know more about. So yeah, it's very cool. That's it. Eating a normal diet and letting your body just work the way it's supposed to work. There's so many different things that it can help. And so I'm just amazed all the time, just seeing all the different great things that are happening medically and with people's health. So that's great. Thanks for sharing that. Cindy L, thank you for the super chat. Any ideas on trigeminal neuralgia on the left side of your face? Yes. So, if this is caused by inflammation, then that should be able to improve. In general, it can improve your experience and interpretation of the pain and reduce your symptoms. But there are other causes of trigeminal neuralgia that are anatomical. So the vessels in our brain, like the arteries, they're not actually static all the time. Some of the vessels sort of in on the surface of our brain can move, and they're sort of bound up in sort of loose connective tissue and the dura, like the arachnoid matter and things like that. But it's not perfect. It's not locked solid like it is in your arm or something like that. And so because these things are beating, they're moving, they just sort of move and they can twist and they can all of a sudden abut against one of the trigeminal nerves or nerve roots or a facial nerve or other sorts of cranial nerves. And so sometimes you can see this on imaging that you actually have this artery sort of wrapped around the trigeminal nerve or where it comes out of the brainstem. And so then you have to go in there and actually just sort of separate that off and put little bits of Teflon material in between the artery and the nerve. And that just sort of gives that a physical barrier. If that's your cause of trigeminal neuralgia, it's not going to move the artery, but it may reduce your symptoms from that, but it may not be enough. You may actually have to get surgery if it's bad enough, and that's something your doctor needs to investigate to see if that's the cause of it. It can certainly help with the expression of that pain and your experience of that pain, because you're just going to get less of a reaction every time it sort of beats and bumps and hits it. But it may not do enough. And there are other causes of trigeminal neuralgia where there is no vessel sort of touching it, and it's just thought to be from just inflammation in the nerve, and that can help because the carnivore diet really reduces inflammation. One, because it eliminates out a lot of things that cause inflammation that you're eating, and two, because higher ketones directly suppress inflammation as well. So, you're getting a sort of a 2-for-1 by doing a carnivore diet that is ketogenic. So you're not eating carbs, sugar, honey, fruit, things like that. Even natural ones like that will raise your insulin, suppress your ketones, things like that. So yes, it can definitely help. But obviously, if you have a vessel pushing on the nerve, it may not fix your problem completely, but it can definitely help with your experience of that. But it's important to investigate that and see exactly what's causing that as well. Okay, Maria Miller, thank you very much for the super chat. Husband has autoimmune caused by demyelinated trigeminal nerve. Can carnivore diet remyelinate this nerve? Can you suggest proportion of fat and protein? Um, well, so if the autoimmune issue, things like multiple sclerosis or other sorts of degenerative processes can definitely improve. You can suppress, you reduce the inflammation. You can reduce the autoimmune action in your body because your body stops reacting to the things that you're eating, and then it stops having these antibodies that are now cross-reacting with the rest of your body. That's what I think the mechanism is. That hasn't been proven, but that's what it looks like to me. Can things remyelinate? Yes, your body can heal and your nerves can remyelinate. And there are people with multiple sclerosis that have these lesions, have damage to their myelination, the myelin sheath around the axons of their nerves, and they improve. So is that a definite 100% that he's going to? I can't say that, but I have seen people do exactly that. It just proper nutrition in general. You're going to help this. You need to make sure his B12 is in good range, is above 400 if you're in Australia. Below 400 in Australia is the level that you can actually get demyelination of your nerve, of your axons anyway, right? Even without an autoimmune disease. So that's very low. And yet, they say, oh, it can go down to like 160. And then 200's fine. No, it's not. 300's not. 400's not. That's the border of being a serious deficiency, I think. And so you want that much higher. So you really, in Australian numbers, you want your B12 between 800 and 1200. And so in the US, I forget the exact conversion over, but it's a little higher than that. But I think it's like 1,000 to 1,500 or something like that. I don't quote me on that. But if you sort of shoot for that 1,000, 1,100, 1,200 range, that's probably fine. But anything, on a carnivore diet, you're going to improve things. You're going to get into a good range anyway. Some people with MTHFR gene mutation might need a little bit more, so maybe a bit of liver once or twice a week. If your B12 levels aren't getting up to where you want. But, yes, eating proper diet, eating a biologically appropriate diet, yes, you can absolutely get remyelination of your nerves. If your body keeps attacking those nerves, they can keep demyelinating. But quite often with autoimmune issues, that stops as well. So hopefully it'll stop the attack on your body or on your husband's body, and then your body will get a chance to heal. You should watch the interview I did with Dr. Sarah. She wants to keep her last name private for privacy, or secret for privacy reasons. But she has a PhD in biostatistics, and very smart young lady. And she had multiple sclerosis, a lot of lesions. She was paralyzed, basically, crippled in a wheelchair in her early 30s. She was dying, really, and she came across carnivore diet. She has a PhD in biostatistics. She knows how to read studies, and she went through and went, wow, there's actually real evidence here, and there's something to this. And so she gave it a try. And after 6 months, she was not only out of her wheelchair, she was back doing ballet. And then on MRI, it showed remyelination of her nerves. So yes, you can definitely do that. And I hope he does really well at that. I'm sure he will. With any autoimmune issue, and for best results on anything, you need to do red meat and water, just lion diet, just high fat red meat and water. And proportion of fat to protein is the same as everyone else. At least 1 gram of fat per 1 gram of protein, up to 2 grams or 2 grams or more of fat to 1 gram of protein. And that seems to be about the range that people do best on. You can sort of adjust to what his body's telling him, what tastes good, how his body's reacting to it, and his constipation versus diarrhea levels. If he's eating, 1.5 grams of fat per protein, and he's no coffee, no tea, no artificial sweeteners, and he's just getting copious diarrhea, that's more fat than his body can absorb at present. And so adjust from there. So just aim for 1 to 2 grams of fat per 1 gram of protein, and adjust from there. So what does that mean? That's around, like if you're doing ground beef, 65% lean, 35% fat. So if you had 100 grams of meat, 35 of those grams would be the fatty portion. And that seems to be about that range, around 2 grams per 1 gram of protein, because obviously the lean isn't 100% protein and the fatty adipose tissue isn't 100% fat. There are other things in there. And so just remember that. Bunny for president. Thank you very much for the super chat. Pattern A LDL confirmed. Great. LDLP 2471, HDLP large 5692, LDL sitting at 334. Cholesterol HDL-C 4.8 ratio, ApoB 194. Doctor is freaking out. Is this normal for carnivore, healthy 5 months in the diet? Look, so your LDL is going to freak your doctor out, but your LDL would go up just by not eating anything, not eating fatty meat, not eating anything at all, really not eating carbohydrates, because when you go into our primary metabolic state, what we term fasting metabolism, the LDL goes up. You're mobilizing fat. You're running on fat. You're running on ketones. So you need more of this stuff to transport this. At least that's what it seems to me to be the mechanism. Either way, when you fast, when you stop eating, or when you stop eating carbs in general, your LDL will go up. There was a study in humans where they fed them 36 eggs a day, very high saturated fat and cholesterol. And after a month or more, they checked their cholesterol levels again, and it did not change. So it did not affect it at all. So your dietary cholesterol actually has no effect on your serum cholesterol, and saturated fat intake doesn't generally have an effect on it. It's your metabolic state that has an effect on it. So if you fast and you eat nothing at all, your LDL goes up. When you eat 36 eggs a day, it does not go up. So this is not diet related. This is metabolism related. And the important thing is pattern A. You have pattern A, you have these large buoyant LDL molecules. That's what you want. And so that's not really associated with cardiovascular disease. It is associated with longevity, though. And just higher LDL in general is associated with longevity. And these are large studies. There was one that recently came out, I think it was with 44,000 people in Scandinavia, and they were looking at really older people and people living over 100 and all these sorts of people, and the long-lived people. And they found that the two biomarkers that best predicted whether you're going to live over 100 was low insulin and high LDL cholesterol, right? So was it LDL cholesterol or total cholesterol? I think it was LDL cholesterol. Anyway, that was something that my friend Mike Metzger, he posted about and did a video about. So if people want to find that and look at that more, they can go and check out his YouTube channel. It goes by Metabolic Mike. And so he talked about that a couple weeks ago. And but yeah, very interesting. And there are other studies as well with actually millions of people showing that higher LDL cholesterol, regardless of pattern A, pattern B, or whatever, higher LDL cholesterol associated with lower all-cause mortality, meaning they lived longer. So I wouldn't worry too much. If and the thing is cholesterol was a scapegoat in the first place. We have hard documentation of this. We have, documentation from the internal memos from the sugar companies published in the Journal of the American Medical Association in 2016, showing that they paid off Harvard professors and Ansel Keys and a bunch of other people to falsify data, make things up, doctor evidence, and push out bullshit in order to cast aspersions on cholesterol and to exonerate sugar and say that it was safe. It's not safe. And neither are seed oils, none of these processed food, nonsensical things that we eat that didn't exist 100 years ago. None of these things are good for you. If it didn't exist, if your ancestors weren't eating it 500,000 years ago or 50,000 years ago or during the last ice age, you should not be eating it. If it didn't exist back then, you definitely shouldn't be eating it. So I would just remember that. I did a video after a debate I had with some cardiologists and things like that, which, we won. It was 2 cardiologists on my side. We won against 3 others. I was the only non-cardiologist. And, we did very, very well. We spanked them. I think we won like 86% of the vote, was in favor of us. And so it's, it's a scapegoat. It was never a problem. So I don't know why we're looking at it anymore. It's not a great biomarker. A better biomarker is your HbA1c and your fasting insulin. If those are low and in good levels, you're fine. Even if you had pattern B LDL cholesterol, a lot of SD-LDL, the small dense LDL, does that cause heart disease, or is it being caused by the same thing that's causing heart disease, right? So is it the smoke or is it the fire, right? Is it a cause or is it an effect? I think it's probably more of an effect. I think it's probably more of the smoke. So, and also it's actually pretty weakly associated. It's not as strongly associated as metabolic issues. So SD-LDL, high levels of SD-LDL, having pattern B increases your risk of heart disease by 70%. So 1.7x. Okay. All right. Well, that's significant. Fine. Metabolic syndrome increases your risk by 600%, so 6x. And type 2 diabetes increases it by 1,000%, 10x, which is up there with smoking. So what the hell are we looking at cholesterol and getting all worried about that for? And if you correct the insulin, if you correct the diabetes, if you correct the metabolic syndrome, which you will with a carnivore diet or a ketogenic diet, that's also been shown. That's really what it's been shown clinically is with ketogenic diets, which a carnivore diet is a ketogenic diet. That is what you're just going to get rid of your SD-LDL anyway, because SD-LDL is caused by eating this crap anyway. You're glycating, oxidizing, damaging your normal LDL molecules. And it's become, that's the problem. So that's where it comes from. So you address your metabolic issues, you'll address your SD-LDL in the first place, and you don't even have it. So you have pattern A, I would imagine that you don't have metabolic syndrome or diabetes either. And so, I would be very happy with that. That's basically my picture. Very, very similar anyway. I have really high HDL, I have really low triglycerides, and I have quote unquote high LDL cholesterol. I think we need to revisit that because I don't think it's high. I think it's exactly where it should be because I'm eating exactly what I'm supposed to eat. And everything else is exactly where it's supposed to be. So why would that be just aberrant for some damn reason? So I did a video going into a lot more depth with this, just called The Truth About Cholesterol and Heart Disease. And you can get that. And I talk about a lot of different studies and a lot of different papers. I link most of them. Probably have to go back and link a few of the other ones, but I talk about them by name, so you can look them up by that reference as well. So check that out, see what you think, and be able to make an informed decision that way. And good luck with it. Deez, thank you very much for the super chat. What is the right response to addressing plaque in arteries on carnivore? Do I pair with 48 to 72 hour fast? I'm afraid cardiologists will want me to switch to plant-based. Well, plant-based will lower your LDL cholesterol, but generally because it's going to, replace the cholesterol with plant sterols, which actually interrupt and impede your body's natural workings and processes because your body needs cholesterol. Your hormones are all made out of cholesterol. All your cell walls and membrane or cell membranes are made out of cholesterol. Your bile is made out of cholesterol. Your brain uses a large portion of cholesterol as well. And plant sterols get picked up in there, and they're not as good, and you get pretty, you're building a building with shitty concrete. You're going to get a pretty derelict building that's going to fall apart, and that's what I believe the evidence shows with plant sterols. So yeah, your LDL will drop down, but is that a good thing? We were just talking about how actually LDL is probably exactly good for you because you make it. Your body wants it. It's not affected by the things that you eat. It's affected by your metabolism. And so, yes, well, it is affected by the plant sterols that you eat. That will lower your cholesterol, but that's a negative, right? You're not able to make vitamin D as well because that's synthesized from cholesterol as well. You get those plant sterols in there, not happening. So if you fast, your cholesterol is going to go up, right? If you just don't eat carbs, your cholesterol is going to go up. If you don't eat plant sterols, your cholesterol is going to go up. Is that a bad thing? I don't think so. I think, again, this is a scapegoat, and that was shown. That's not a contention. That's not a theory. That is a fact. It was used as a scapegoat by the sugar industry. That's in their own words, right? So that's published in the Journal of the American Medical Association in 2016, and that's linked in a lot of my videos that I talk about it, and certainly in that one on cholesterol. So check that out. Addressing plaque in the arteries. No, I think that eating a low inflammatory diet, eating your biologically appropriate diet, and not eating carbs and sugar and seed oils and alcohol and smoking, that all these, and nicotine can directly damage your artery walls and cause plaque buildup. So don't do that. And it's even suggested that it's the plant sterols that are actually getting deposited in the lining, because the macrophage is tying on tightly to cholesterol. They don't really like the plant sterols, so they sort of puke them up. And if they're puking those up in the cell, in the lining of your arteries, that can build up. And they've actually found some of those in different plaques and things like that. So that's at the end of the day, it's your choice. You get to decide what you do with your body and what you eat and what medicines you take. So just remember that. What do? You eat an appropriate diet, you eat a biologically appropriate diet, low inflammatory diet, you lower stress, you meditate for 30, 40 minutes every day. That's the only controlled trial that's ever been shown to reverse plaques, was meditating 40 minutes a day, and that removed plaques. So stress is a big one. And but eating the right things is a big one too. So you eat a low inflammatory diet, you reduce your stress, and then you check your plaque levels again. Check them in a year. It's not going to change, dramatically in a couple of months. Or you check it in 6 months to a year. You get your baseline now, and you get it again in a year, and you remove your stress, you remove the inflammation. That should improve, and we're starting to see that more, anecdotally now as well. And removing visceral fat is something that Dr. Sean O'Mara is showing, that people have blockages in their cerebral circulation, cerebrovascular circulation, and you remove the visceral fat with a combination of carnivore diet, sprinting, weightlifting, and some other sorts of interventions that he goes into. But they're all lifestyle stuff, and they're all stuff that we do, that I do, and that's why we connected, was because we're like, hey, we've come to the same conclusion from sort of different directions. And he finds that you remove visceral fat and blockages clear up as well. And he did a study with over 6,000 people looking at visceral fat and reversing it and seeing its effects on metabolic health for the National Institutes of Science. So he knows about this. So I would just keep doing a high fat carnivore diet and arm yourself with information and understand what's going on, and go from there. And then just check, get objective markers. This is the blockages I have now. Check it again in a year, doing what you think is right. See what's happening, adjust from there. Tall Cedars, thank you very much for the super sticker. I appreciate it. Also, guys, we're sort of coming up. I only have about 20 minutes, so maybe don't do any more super chats, so that so I can get through all these, because I don't want to leave anyone hanging. S Golan 90, thank you very much for the super chat. Hi, Anthony. If plants are truly trying to kill us with defense chemicals, then it doesn't seem very effective, since people still eat them, and most people don't know plants are doing any harm to them. Look, that's a good point. And the thing is that different plants have different amounts of poisons. But if you get lost in the woods and you run out of food, you can't just eat any random plant. Most of them will kill you. Most of them will do a very effective job at defending themselves. Most plants on Earth are termed inedible, meaning that if you eat them, you can die. You can get very sick. And so they're actually doing a great job. And the thing is that what we're not realizing is that slow poison is still poison. And just, I'm sure you wouldn't contend that smoking is not harmful. We recognize smoking tobacco plant as harmful, right? You eat tobacco, you'll die, right? It's very toxic. We smoke this stuff, it gives us a bit of a high, and we feel nice with it. But you smoke too much, you get very sick as well, acutely, right then and there. when people first start smoking, they smoke once and they're getting all buzzed and weird, and they have two and they feel nauseous and all these sorts of things. So you can build up a tolerance to any drug, to any toxin. There's a famous story of a I can't remember his name, but it was an ancient Greek king, and he was very worried about getting poisoned. So he would microdose himself with hemlock and other poisons that were used at the time, and he built up an immunity to it, sort of like in Princess Bride, where the iocane powder. He sort of built up this immunity to it. Then he could poison himself, poison the other guy. He died, and he didn't because he was immune to it. You can build up these immunities. What does that mean? This is a toxin that's harming you, and you build up immunity over time. And there's this king that built up immunity to hemlock and things like that, and then his country got taken over, and he was just like, oh, they're going to torture me and kill me and hurt me and all this sort of stuff. I don't want to do that. So he drank a whole cup of hemlock. It didn't kill him because he was immune to this stuff. Not immune, but he had built up a big tolerance to that. So, but 100 years ago, we did not have the chronic diseases that we have now, right? 200 years ago, 1,000 years, we did not have any of these things. And, native populations don't get these diseases when eating their natural diet. And this is what they used to be called diseases of the West, because it was like only Western people are getting this. Well, when people started eating the food of the West, they got the diseases of the West. So you actually can get sick. Does it kill you overnight? No, but neither does smoking. And we still recognize that as toxic. These are still defense chemicals. It's just we have more innate ability to detoxify them and to weather them than we do other things. But the thing is that, if you look at cats and dogs, you have to keep them away from food and plants that humans eat because they'll kill them, right? So like nightshades, tomatoes, potatoes, eggplants, peppers, these sorts of things can be very toxic to cats and dogs. And chocolate, can kill dogs, all these sorts of things. So there are toxins in them. The plants are trying to defend themselves. It's just that we have a better ability to detoxify some of these things than others, but they can build up and they can slowly get you, right? So, if you're dying at 60, 90, even 100, you're dying decades early because we're designed to live 120 years. And so if you died at 85, wow, he had a good life. No, he died 35 years early, right? And that's generally from chronic toxins. If you smoke for decades, that's going to harm you. That's a poison. That's a toxin, right? And the same is true of these other sorts of things. It's just that, they build up over time. And so they actually do a good job. And if we can't eat eucalyptus, we'd get very sick if we did, but we can eat spinach. And Liam Hemsworth put himself in the hospital with acute oxalate poisoning from eating, spinach smoothies every morning for 3 weeks. So that's doing a pretty good job. But, most people will eat, spinach and things like that, especially if they're doing it, not every day in huge amounts. They'll be able to sort of weather that, right? But we can't eat eucalyptus, but a koala can. Koalas can't eat spinach, though. And they can't eat other vegetables that we eat, right? Because there are toxins in there. They are trying to defend themselves. It's just animals have built up an ability to detoxify certain things so that they can eat them. But all plants are poisonous. It's just that certain animals have evolved certain defenses against specific poisons so they can eat that plant with those poisons and survive. And that's the thing that we need to understand and realize and really respect about plants, is that they are trying to defend themselves. And whether or not they kill us that night doesn't mean that it's not causing harm. And it doesn't mean that it's 100% safe for us, or that we're biologically adapted to it, or that they don't have toxins, because they do have toxins. They definitely have toxins. It's just we're better able to weather and detoxify them than other things. So thank you for your question. That's a very good point. That is good to just good to bring up and good to think about. Snowline, thank you so much for the super chat. It's very generous of you. On keto carnivore for many years, got COVID a month ago, lethargy, mental confusion, and slow cognitive processing speed wouldn't go away. Already on best anti-inflammatory, high-fat carnivore diet. What else can I do to help with these neurological symptoms? Yeah, that's really tough. I'm very sorry to hear that. Well, look, you're already doing that part, right? So you're addressing your health in ways of eating right, high fat carnivore diet, great. sprint, lift weights, do these sorts of things that are going to stimulate you in good ways, doing dry saunas, things like that. And light exposure, getting outside, doing natural things that are good for your body, getting proper sleep, reducing stress. All of these things are very important. But because of this specific issue, you have all these spike proteins that are running around damaging your body. They can stay in your body for a very long time. Dr. Peter McCullough, he has come up with a protocol for detoxing and getting this stuff out of your system. And that's something that they've published. So this is something that actually has some evidence behind it and can help get rid of this stuff out of your body. Some of these supplements, maybe, I don't know if they're herbal or whatever, but there are some of these things that, again, they may not be carnivore, but they're medicine, right? So you can take this for a period of time to help your specific situation to sort of get this stuff out of your system, and then you get off of it, right? You don't need to be on this stuff forever. You don't need to be on, shouldn't need to be on medicine forever, unless it's a very specific sort of genetic issue. But that's what I'll look up. Look up Peter McCullough. He has a protocol. I don't recall it offhand. Actually, I might have it in my phone. Give me 2 seconds. Okay, so I didn't write down the actual protocol, but I just have a link here. So he has a video on Rumble where he talks about this. So I would look that up. So he has a protocol anyway that you can sort of detox this stuff out. So that's what I would look for. Do all the things that you can do, and then find the protocol by Dr. McCullough, and hopefully that will do the rest of it. So good luck with that. Connie Martin, thank you so much for the super chat. Hi, I have 2 overweight adult sons that I have convinced to try carnivore. Great. They are mostly eating leaner cuts of meat. Should they be adding fat? They are also transitioning slowly. Still eating some salad and diet pop. Yeah, look, fair enough. If you sort of eating more meat is very important. Eating less of the other crap is also really important as well. And if they can't do it just all in one go, that's fine. They're at least moving in the right direction. Yes, they need more fat. So fat is very important. It's an essential nutrient. You need it. You need it for your brain, your body, your hormones. These are especially important to young adults and certainly to developing adolescents. Need more fat. So 1 to 2 grams of fat per gram of protein. That's what you want to aim for. It tastes better anyway. So if you want to get fattier cuts, or you can add butter or tallow as well. And those are some good ways of bolstering up the fat. Eggs are good too. Those are fine. And so that's totally fine. Just try to eat more fatty meat, try to eat less of everything else. And then at some point, just have them say, okay, well, I'm going to try it for 30 days of just nothing but fatty meat and see how you go. And then just make a decision from there. And, but yeah, definitely eat more fat, and good luck to that. I hope they do very well. I'm sure they'll feel a lot better. Shuriken LM, thank you very much. Good to see you, buddy. Are you going to write a book with a diet for type 2 diabetes? Because I noticed that my blood sugar is not under control. Could it be my Eliquis? I take blood thinner for my replaced valve. Not that I know of. I don't know of Eliquis affecting blood sugar. I wouldn't think it would. So with type 2 diabetes, I mean, you really just want to avoid carbs, sugar, seed oils, alcohol, all that sort of stuff. Also stress. There's different medications, certainly prednisone, prednisolone. Those can really just cause diabetes. And so you want to get rid of those if you can. And then you want to reduce stress as well. That can be a major issue also. And then just eating proper. That should help most people. Also, how are you judging your blood sugar? Is it your HbA1c, or is it your spot test, or do you have a constant glucose monitor? Sometimes those constant glucose monitors run a bit high, and so you spot check and say, okay, is this adding up? Is this lining up? Also, artificial sweeteners. I've seen people with, who monitor their glucose closely. They've noticed that artificial sweeteners absolutely derange their blood sugar and things like that. So, and can possibly increase insulin secretion and insulin production as well, which you don't want. So I would think about all those things. I would reduce stress. I would spot check your blood sugar. And if that's all normal, then your CGM may be running a bit high, or your HbA1c might be marginally high because, it's thought that, when you're a bit more healthy, when you're eating carnivore diet and you're not having all these plant sterols that screw with the cell membranes, that get in the red blood cell membranes, and they die earlier, that your red blood cells live longer. And so you're actually looking at like a 3.5, 4 month average for your blood sugar, as opposed to what we're assuming is a 3 month average, because they don't necessarily only live 3 months. And so that's what you have to think of as well. So if you're basing this off your HbA1c, most people will have HbA1c below 5.5, which is sort of the border for pre-diabetic. But some people are a bit above that, but they check their blood sugar all the time. And it's just, 65, 65, 65, 65. Like, that should not be a 5.6 then, or a 6. But sometimes it is. So that's probably that case, that their average it's actually a longer average, actually looking at a 4 month average as opposed to a 3 month average. And so that's what I would do. But most people reverse their type 2 diabetes with just a carnivore diet. But the other things add in it as well. So artificial sweeteners, stress, medications. I don't think Eliquis does that, but I'm not sure. And if you have a replaced valve, like you need it, unfortunately, probably no getting around that. But good luck with that. Let me know how that goes. Gil Ramirez, I started a strict carnivore a month ago for weight loss. No health issues. Started at 257, currently at 246. Great job. What do you recommend so I can speed up the weight loss? Less food, cardio, extended saltwater fasts. Thank you. Look, I would just let your body do its thing. I don't think you need to micromanage these sorts of things. I lost a decent amount of weight in the first couple of weeks that I went on a strict carnivore diet. Just dropped greens. I wasn't eating processed crap. I wasn't eating carbs. I was already, on a ketogenic diet, even though I wasn't doing keto. I just wasn't eating carbs because they didn't make me feel great. And I just dropped vegetables and I started eating a lot more meat, and I lost 23 pounds in 10 days. But then I didn't lose anything because I was working out, I was lifting weights, and I was losing fat, but I was also gaining muscle. So it offset. It actually perfectly offset. I weighed the exact same every single morning for months after that. I was 243 pounds on the nose every single day. And it was pretty crazy. So I wouldn't worry too much about the scale. I wouldn't worry too much about speeding up weight loss. You lost 11 pounds in a month. Most people would say, oh my God, that's too fast. Oh, that's bad for you. No, damn well isn't. That's what your body wants you to do. So just eat fatty meat until it stops tasting good. Do not go lean. I don't think that's the right thing to do. I think it's not just a calorie source. It's a nutrient. It's an essential nutrient. So eat as much fatty meat as tastes good to you, as long as you're not on medications or other sorts of things that are going to screw with that. And lift weights. Do sprinting. That's what you want to do. Extended cardio is not as good as weightlifting and sprinting by a long margin. I wouldn't do saltwater fasts. I don't think you need to. If you're fasting, if you're limiting food, then you're going to lower your metabolism. And so, yeah, sure, you can starve yourself into smaller pant size, but that doesn't mean that it's going to be the best way to do it. That's not necessarily going to be the healthiest way to do it. And your metabolism is going to be suppressed, and you start eating again. That's going to come back on because your body's saying like, whoa, no, we're in a famine. We need to store this, right? So don't mess with it. Let your body know you're not in a famine. You're not, a deplete of resources, that you're doing fine. And your body will react. You're already losing weight. Just let it go. You're probably gaining muscle too. Remember that I didn't lose weight for months, like months and months and months and months and months. But I could look in the mirror and I knew that I was losing fat and I was putting on muscle. I don't care what my weight on a scale says out of, past just a cursory interest. It's not it's not telling you body composition, right? So body composition is more important than weight. Health is most important of all, right? You're feeling better, you're doing well. That's what you want, and you're clearly losing fat. You're going to be putting on muscle, and so I wouldn't worry about the weight side of the thing. I would just keep doing what you're doing. Eat fatty meat until it stops tasting good. Lift weights, sprint, get outside in the sun, and get proper sleep. The rest will take care of itself. You don't need to get to the finish line in 2 months. For me, I wasn't complete. I still had a six pack, but I was definitely overweight. It took 8 months before my body got down to a stable body fat percentage. And I was lifting weights for 3-4 hours a day and playing rugby. Like, it takes time. Don't worry about it. It's a marathon, not a sprint. Although you should be sprinting, not doing marathons. So anyway, just good luck with that. You'll be fine. Don't worry about it. Just enjoy the ride. Enjoy feeling great. Enjoy the fact that you are losing weight. And you probably had difficulty with that before. And now you're just doing it just by eating as much as you want to of what you want to. So that's great. So lift weights, do sprints, eat meat, be healthy, and the rest will come. Good luck, and good luck with that. Okay, Bloom, thank you for the super chat. Thoughts on face care? You recommend emu oil on Amazon. I bought some and it seems very hydrating. Tallow, 105 days, carnivore, eggs, beef butter, salt only. My skin still breaks out a little. It can take time for the hormones to sort of fix themselves. There's other things, obviously, we have different exposures and things like that can cause you to break out. Dairy seems to cause people to break out a lot as well. Just think about that. Maybe eggs. Also, you can try sort of adjusting some of those things. But emu oil is great. It's very, very nourishing. It's very good for your skin. Tallow's, I think, probably even better. It's just that emu oil is a bit easier to apply because it's already sort of just a thick, viscous liquid. Whereas tallow is more solid at room temperature, but you can sort of melt it up with your hands and then spread it on your face. But I've definitely found that tallow is hands down the best moisturizer lotion that I've ever come across. It's amazing. So I would be that's what I use, and I think it's absolutely amazing. Shameless plug, but I'm a brand ambassador for Stone and Spear tallow products, and so that's what I use. I like their stuff. They don't have a bunch of they do have scented stuff, but I get the stuff that doesn't have scents. And because I don't want that. I want the tallow soap. I want the moisturizer. I want all these sorts of things. So they do more soaps and things like that. But that's what I generally use, as a soap. It's much less harsh. It doesn't dry out your skin as much. And then I just use emu oil or tallow. You don't need anything special. You just get the cooking tallow. Whatever's cheap, it's fine. Someone told me was tallow actually was the Latin name for sebum, and that's because people found that beef tallow is actually very, very similar to our own natural oils that we secrete, our sebum, and so that's why I call it tallow. And so that could be a reason why this is a very good moisturizer for your skin. So I would definitely use that, and give it time with the acne, and cut out dairy and things like that. See if different things that you eat affect your acne as well. And good luck with that. Brian Bardo, thank you for the super chat. Thanks for doing what you do. Well, you're very welcome. Thank you. Question: can carnivore reverse atherosclerosis and reduce or eliminate over time plaque in your arteries caused by or a previous poor diet? I think so, and I've certainly seen cases where that's happened. I was speaking to Dr. Jamie Seaman, goes by Dr. Fit and Fabulous, and her husband apparently has done this, and they were looking at writing his personal experience with that up as a case report in the literature. So still at the case report level, we're not randomized controlled trials, but like I said, Dr. Sean O'Mara has shown that you actually can reverse atherosclerosis in the brain, at least, with by removing visceral fat. And carnivore he found is the best diet to remove visceral fat, and then sprinting and lifting weights and other sorts of things as well. So yes, I do believe that it can. We're sort of still in in the more anecdotal case report, and then obviously Sean O'Mara's work, and that was with like 6,000 patients, but I don't know how many had atherosclerosis and how many reversed that. I do know that some did anyway, and he had that on imaging, successive imaging showing that cleared up. So yes, I do think that it can. We don't have big studies showing that yet, but I believe they will come. And either way, it's going to be good for you, and you can check it yourself. Reduce stress as well. Get better sleep, get in the sun, lift weights, sprint, eat a proper diet. And I think that, yes, your body can do some amazing things. Avatar 007, thank you so much for the super chat. Despite 4 months on carnivore, still very thirsty. Tried no salt, electrolytes, low or none. Often need to urinate middle of the night, even if I don't drink late. Yeah, look, it's if you're thirsty, you need to drink. Right? That's your body telling you that you need more water. There could be prostate issues as well that may be making that a bit of an issue. But those tend to improve as well, depending on the prostate issue. But that's something that Sean O'Mara found, that he removed his visceral fat, and he was having a very difficult time peeing and going up 4 or 5 times a night to pee, and and then after he removed his visceral fat, he didn't have that problem anymore, and he was peeing, and it was like like a kid again, so like Niagara Falls as opposed to like a little trickle, right? So you can improve these things, but it does take time. But if you are thirsty, you need to drink water. But yeah, like you say, try not to drink late. Sort of stop in the afternoon if peeing at night is a problem. Try to pee before you go to bed, things like that. If you get up to pee, once or twice a night, it's unfortunate, but it will probably improve. But you do need to drink enough water. If you're getting that thirst response, you're thirsty, you need water. So I would drink more water, even if it means peeing. Fran, thank you for the super chat. Question: this way of eating for 3 months and lost 22 pounds. Fantastic. Haven't had a bowel movement in 2 weeks. Any suggestions? Do I need to worry? Depends. Are you eating enough fat? It's if you were eating enough fat, you're eating the same amount of fat, and your bowel motions were soft prior to that, then the likelihood is that they're still going to be soft. If you start getting diarrhea and loose stools, and all of a sudden you get this big, hard, rocky thing come out, well, okay, maybe you're eating so much less fat that you are sort of getting a bit of a blockage, and then you need to eat a lot more fat. So it depends on how much fat you're eating. It depends on what your bowel movements were like prior to that 2 weeks. And was your last bowel motion, was that just soft and nice? Did you change the amount of fat? Did you start eating less fat since then? What you can try to do is just see how much fat you're eating. Try and make sure you're getting sort of 1 to 2 grams of fat per gram of protein. And if you're not, get up to that level and then see what that does. But no, just because you haven't gone doesn't necessarily mean that you're blocked up. What it often means is that you don't have anything to go because you haven't been eating things that build up residue, because you're not eating a bunch of fiber. But you can get constipated if you're not eating enough fat. So maybe try upping the fat, see what happens. If you're getting that dry, hard, blocky thing coming out, you definitely need a lot more fat. And 2 weeks is about as long as I've heard. I don't track this stuff, but I would say once or something a week is pretty typical. And for a lot of people. And 2 weeks can happen too. It just depends on how much you're eating and what you're eating. Salisbury steak is grinding a hamburger so that you filter out the gristle. You will absorb basically 100% of that, and so you won't have any bowel motions really for weeks at a time. So it depends. So if you're eating very low gristle meat, yeah, you're not going to have much coming out. But just make sure you're getting enough fat. If that's hard and rocky, you need a lot more fat. Or you're getting overflow diarrhea where you're getting so hard and rocky, they're just getting liquid stools around it because it's sort of sliding around the outside. You definitely need a lot more fat. Bloopy doop. Thank you very much for the super chat. Carnivore diet, 10 months, but I had a sugar binge that destroyed my gut. Back on carnivore, but my stomach is cooked. Meat doesn't sit well. Even water upsets it. Any idea what I did to my stomach? Is it an ulcer? Well, maybe. I mean, I don't think that a sugar binge would necessarily cause an ulcer, but depending on what else you're eating, maybe you sort of got a concomitant infection at the same time. You can certainly talk to your doctor to investigate for an ulcer. But if you're just sort of getting upset and all that sort of stuff in your stomach or in your gut in general, it could be a microbiome sort of thing. You're eating a whole bunch of sugar that can feed a whole bunch of bacteria that you don't want. Get SIBO, small intestinal bacterial overgrowth, and that just takes time. It takes time to clear that out. And on a carnivore diet can do that. There have been small case series published on SIBO and carnivore, specifically carnivore, and showing that, like these 6 patients improved. Very small, only 6 patients. It's not well powered or anything like that, but it's sort of a good, it's a good, it was a good start anyway. And it's a good, study proposal, saying, hey, look, there's something here. Maybe let's do a bigger study. But there are people that are doing this anecdotally. There's a lot of people around that improve SIBO. If you do think there's a bacterial issue, if you do think it's a microbiome issue, and have a small bit of live culture yogurt, plain yogurt, no sugar or no flavorings, certainly no fruit, and put that on some meat, chew the meat with the yogurt, swallow it together, just have like just a spoonful or 2 once a day for a couple of weeks. See how that goes, and just give it time. And then if you do think it's an ulcer, if you're getting a lot of pain in the stomach when you eat, or you have a lot of pain in your stomach and then you eat and it goes away and then it comes back, that could be a sign you have an ulcer in or just outside of your stomach. And so it's important to go see your doctor and make sure that that's not the case. And if it's not, then just do what I recommended and it should settle down, hopefully. But your doctor may have may be able to find something else that's going on as well. Okay, good luck with that. So this is going to be the last question, everyone, and then I've got to run off to the hospital. But last question is from GE1RI4. Thank you very much for the super chat. Very generous of you. Dr. Chaffee, I started low carb before the pandemic and am about 90% carnivore now, but my calcium CT score went from low a year ago to medium this year. Could a bout of COVID or COVID vaccines have been a factor in my CT? Potentially. I mean, that's a problem with these sort of things. We don't really know what the hell it does to our body and the different ramifications long term or even really medium term of this illness and the vaccines. And that's sort of people's contention is that, okay, well, we don't have long-term data, so that's a bit risky to put something like that in your body, which it is. If you don't have long-term data on something, you don't know what happens long-term. So calcium score can go up for a number of reasons. People go say, oh goodness, you have a high calcium score, you need to go on a statin. Well, what do statins do? They say it protects you from heart attack by stabilizing the soft plaques and turning them into hard plaques, which don't crack as easily. What is that? That means your CAC score goes up, right? So your CAC score going up, that means you need to go on a statin, which raises your CAC score. Okay, so is a higher CAC score necessarily bad? Well, they say no. They say, well, there's a soft plaque and it turns that soft plaque into hard plaque, and that's better. I don't know if it is or not, but that's the contention. So you could have soft plaque, and maybe that's stabilizing, solidifying. So your CAC score going up, is that necessarily a bad thing? Well, if it were, then there's a big mark against taking statins, isn't there? Because statins raise CAC score. So it's not, even by their argument, not necessarily a bad thing to have your CAC score go up. Okay. But as far as plaques are concerned, can that go up on a carnivore diet? Sure. If you're stressed out and you're not sleeping properly, that that can cause these problems as well. And diet is not the only thing that causes atherosclerotic plaques. You can certainly get this from stress. Again, the only RCT that ever showed a reversal of arterial plaques, atherosclerosis, was meditation, reducing stress, 40 minutes a day, mindful meditation, deep breathing, and for 40 minutes a day, these people reverse their atherosclerosis, right? So you're reducing cortisol, you're reducing stress, you're getting better. Okay, so there are other things that can be at play here. It also can be that your soft plaques are going down, but some of them are stabilizing, so your CAC score sort of went up, because the coronary artery calcium score doesn't actually show the amount of soft plaques you have, just the calcified plaques. So I would expect that if you do other things, sleep properly, reduce stress, sprint, lift weights, eat carnivore. You're 90% carnivore now, but what else are you eating? Are you having seed oils? Bad idea. Are you having sugar, artificial sweeteners? I don't think those are a good idea either. Carbohydrates, so you're doing low carb, but are you doing no carb, right? Because there's a difference. And if you're eating enough carbohydrates that your insulin goes up, that causes metabolic distress and problems, and can cause glycation, can cause damage to your arteries, and so on. So it does depend on what else you're eating. It does depend on a lot of other things. But if you're reducing stress, getting better sleep, and improving your diet, getting rid of the seed oils, processed foods, sugars, carbs, things like that, you're going to improve. And so I wouldn't worry too much at this stage. I would just continue doing healthy things, reducing stress, reducing inflammation, exercising properly, sprinting, weightlifting, and check it again. Check it again in 6 months or a year, see what's going on. Also, and remember that the CAC score doesn't necessarily look at the soft plaque and atherosclerosis. It's just the calcified version of that. Also, if you were put on a statin at one point, your CAC score is going to go up. So that's going to go up no matter what you do, right? Because that is what statins do. They are, that's in that they say it. We solidify and strengthen these plaques, right? And that's a good thing. We add calcium to it. Okay, I don't know if that's a good thing or not. Hardening the arteries, I don't know, but that's what they say they do. And so if you're on a statin, your CAC score is going to go up as well. So just remember that. Remember, there's a lot of factors here. Could getting these sorts of illnesses cause problems? Potentially. We don't know everything about it yet. You could look in Peter McCullough and Dr. Peter McCullough, Dr. Malone. They've done a lot of work in this area, and there's a lot of others as well that have seen a lot of the associations with significant increased uptick in other sorts of diseases, since the pandemic and things like that, and see different associations and see if there are people, and there are people certainly having cardiac issues, 100%. And so, is that one of those things potentially? And so that is a factor too. But the other things you can address at least, and you can go on Peter McCullough's. You find Peter McCullough's treatment protocol for sort of detoxing the body from all this stuff that we got during the pandemic, and hopefully that all helps you out and settles things down as well. And then I would just not worry too much about it, and just check it again in 6 months to a year, and you probably will find an improvement actually. Okay, all right, everyone. Thank you so much. I really appreciate it. I do have to run. I will be posting a new video. I didn't do one this past week just because I was traveling. I was in France for the Rugby World Cup quarterfinals, which was amazing. That was a fantastic experience. So maybe we'll talk a bit about that on the next live, but that was a great experience. And so I'll be posting another great interview on Monday, Australia time, Sunday afternoon, evening, as per usual in the US. So hopefully we can get as many people as we can there for the premiere, and that really helps bolster things up and get YouTube knowing that people like it, and hitting like and all that sort of stuff, and that gets that out to more people. And so if everyone can sort of hit like here as well and leave a comment, also leave a comment about your vision, right? So people that have improved their vision, please tell me what kind of vision issue you had, what kind of glasses, nearsighted, farsighted sort of things that you had, and what improved, how long it took, and all that sort of stuff, because that is really interesting. And I've heard more and more about that. And others that have improved different sorts of health issues, leave that in the comments as well. What issue you had and what got improved by it. And we need this data. We need more and more people talking about the things that they're improving, because that's what encourages other people to try this themselves. And obviously, if you get a whole bunch of people saying, look, I had this specific issue and it got better in this way, and you have thousands of people saying that, that's very good data, right? So please do that. And then I will see you guys on Sunday or Monday for the next episode. I'll do that as a live premiere, and we'll be chatting in the live. Obviously, the video is pre-recorded, but I'll be chatting with you guys while we watch as well. So great. Thanks, everyone. Have a great rest of your week and a great weekend, and I will see you for the premiere. See you, everyone.